Hello everyone. Am I live? Can you see me? Can you hear me? A very good morning to all of you. Give me a minute to confirm whether I'm visible or not. So I hope it's working. Okay. So very good morning to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to continue my series of bacteriology. I'm going to start this series. Just a second. I'm sorry. Okay, so I'm going to start bacteriology today. I'm going to start bacteriology today. So in this series, I'm going to continue. I'm going to cover all bacteria, starting from Staphylococcus. I will continue with Streptococcus, then Neisseria, then Pneumococcus. One by one, we will cover all 40 bacteria which are important in MBBS syllabus for university exams of microbiology, of pathology, as well as of the competitive exams. So I am going to continue the entire bacteriology in a more simplified and a unique manner. What is unique, you yourself will know or come to know after a few minutes. So give me a minute to start the series. Okay. So we know based on the gram staining, yesterday we have studied gram staining. Based on the gram staining, we have two types of bacteria. What are the two types of bacteria based on gram staining? Gram positive bacteria, gram negative bacteria. Gram positive bacteria are the bacteria which are violet in color in the end or blue in color in the end, and they retain the primary stain. Gram negative bacteria are the bacteria which are red in color and they retain the secondary stain. Right? We know that. Based on the shape, bacteria are of two type. Based on the shape, bacteria are of two type. The bacteria which are spherical in shape, these are known as cocci, coccus, and the bacteria which are rod shaped are known as bacillus. Now combine the two type. You have to combine the two types. मैं तो white board ऐड किया, कुछ तो चेंज हुआ है ना रजत, क्या वो नहीं पता, अब ये कौन करके देगा? स्ट्रीमिंग के टाइम पे चेंज हो रहा है, क्योंकि मेरे बिना स्ट्रीमिंग के सब चेक करते हैं तो लाइव हो रही है. Hello everyone, I hope some technical error is going on. That's why the video has been paused. I guess it is continuing now. I'm sorry for the trouble caused. Let me continue now. Okay, so I welcome you all for this session. I am Dr. Priyanka Sachdev here, and today I am here to start a new series in pathology as well as microbiology, the integrated series, that is bacteriology. So I am going to teach you all bacteria one by one. I was about to teach you the classification in which I am going, the sequence in which I am going to take the various bacteria. So here we are going to combine two things together. Number one, some bacteria are gram positive, some bacteria are gram negative based on the gram staining. On Saturday we have learned gram staining. Based on that we divide entire 40 bacteria. Some of them are violet in color, they are gram positive. Some of them are red in color, they are gram negative. The second classification is based on the shape of the bacteria. Now some bacteria are spherical in shape, that is known as cocci. Some bacteria are rod shaped, that is known as bacilli. So we divide the bacteria into four categories, that is gram positive cocci GPC, gram positive bacilli GPB, gram negative cocci GNC, and gram negative bacilli GNB. So these are the four categories of the bacteria. We are going to divide the bacteria in these categories. Now there are many bacteria in each category. Let me start the first bacteria today, that is Staphylococcus. I am starting with the first bacteria today, that is Staphylococcus. So what is unique in bacteriology here? I am going to teach you entire bacteriology in a tabulated manner. Now this is the unique thing which no one else in this world will teach you, right? Give me a minute. Okay, so can you see here in this page I have taken only three bacteria. I request all the students to take their notebook, to take their pen along with the lecture right now, and while watching the lecture listen to the lecture also and make these tables also. Once you will make these tables for all 40 bacteria, then at the end revising bacteriology will be fun for you. You can revise entire bacteriology in just 1 hour if you are making these tables with me. So I request all the students to make these comparative tables of all bacteria with me. I am going to discuss all the bacteria one by one in this manner. So there are constant headings under which we will describe the bacteria. In the introduction, I will tell you the name of the scientist and some important points about the bacteria that you have to note down in the introduction of each bacteria. In the morphology, you have to tell me three things: whether the bacteria is capsulated, yes or no; whether the bacteria is spore forming, yes or no; and whether the bacteria is motile, yes or no. Capsulated, non-capsulated, spore forming, non-spore forming, motile, non-motile. You have to tell me three things. Then you have to tell me all the possible culture media which possible for that bacteria. Then you have to tell me all the biochemical reactions possible for that bacteria. Then you have to tell me the antigenic structure, the resistance, the virulence factor. You have to tell me the diseases caused by that bacteria. Enumerate the diseases along with the symptoms, right? Then you have to tell me the lab diagnosis, what specimen you will take. You are a doctor, what investigations you will order to confirm the diagnosis. In the end, what is the drug of choice? What is in treatment? I will discuss only drug of choice. What is the drug of choice to treat that bacterial infections, and what is the prophylaxis we can do? So these are the constant headings under which we have to study all bacteria. Now in the new syllabus, I know that the entire bacteriology is also system wise. Do you have bacteriology system wise in your syllabus? So nowadays the bacteriology is not studied bacteria wise. Many students ask me to take it system wise. So for them, I would like to say something. Here I am going to teach you the bacteriology in this manner only. Bacteria by bacteria we will continue, and we will discuss all the important 30-40 bacteria in your syllabus. After that, I will ask you to see this column of all the 40 bacteria. Once the tables are ready with you, see the pathogenesis. In pathogenesis, you have to write the system the bacteria is involving with system. Like Staph aureus, it will cause food poisoning, so it will involve the GIT also. It will cause the pus in the entire body, in the multi-system. So all the systems, you know, pneumococcus will involve the lungs, right? So you have to write the system along with the disease and the symptoms and pathogenesis. Now looking at the pathogenesis, you can combine all the bacteria from GIT. So that will be the bacteria from GIT. You can combine all the bacteria from the lung. So that will be the bacteria from the respiratory system. So in this way, we can complete bacteriology both ways. Bacteria wise also, system wise also. First, give me a thumbs up if you got it. G1, Pradeep, anyone else who can listen me live. Give me a thumbs up if you can listen me live. Give me a thumbs up if you got my point. So this is how I am going to continue the bacteriology. Let me start the first bacteria today. Staphylococcus under these headings. I am going to discuss Staphylococcus under these headings. Please, everyone, those who are not following my commands, they are doing a big mistake. They are not following my advice. They are doing a big mistake, and you will, you know, in future you will realize that one day ma'am told us to make these tables. Making table is the most simplest form in which you can retain bacteriology. Otherwise it is very volatile. Today I will teach you the first chapter, Staphylococcus. Staph aureus is the main bacteria there. So you will understand everything. But tomorrow when I will teach you Streptococcus, then I will teach you Pneumococcus, you will forget Staphylococcus. So once the tables are there, in comparative manner you will study all 40 bacteria. You will never forget. You can compare the morphology of all of them. You can compare the culture media of all of them. So you can learn the bacteriology in a comparative manner. So the retention will be very, very, very easy. Have you got my point? Okay. Let me start the first bacteria, Staphylococcus. Start writing in the table. Start writing in the introduction. As we all know, Staphylococcus is a gram-positive cocci. The first thing, it is a cocci. It is sphere. It is not a rod shaped. It is a spherical shape. So it is a sphere. And the second thing, it is gram-positive. It is not gram-negative. It is gram-positive because it is violet in the end on gram staining. Right? It is the most common cause of suppuration. The word suppuration means pus. So anywhere in the human body, the pus formation, it is caused by Staphylococcus. It is caused by other bacteria also, the pus formation, but the most common cause of pus-filled lesions is Staphylococcus in the world, in human body. So write that in the introduction. If you want to write the name of the scientist are in front of you. Who discovered? Name the scientist who has discovered Staphylococcus. So the Sir Alexander Oxton is the name of the scientist who has given the name Staphylococcus to this bacteria. Why these bacteria are known as Staphylococcus? Because number one, coccus. Coccus means they are sphere, and Staphylo, they are in bunches. They are in bunches like the grapes. Have you seen grapes? The grapes are there in the form of the bunches of the grapes. So the bacteria remain in bunches. Bunches. The word here is bunches. The word bunches in Greek language, it is known as staph. Staph means bunches. So Staphylococcus is the word given to them, right? They form golden yellow color colonies. They have a pigment inside them because of which they form golden yellow colonies. And there is another scientist which is known as Rosenbach who differentiated two types of Staphylococcus, Staph aureus and Staph albus. One is pathogenic, cause diseases in human, that is Staph aureus, and one is non-pathogenic, right? It is a common cell, so that is Staph albus. So I will teach you both the Staphylococcus. The main is Staph aureus. Okay, so there are two type of gram-positive cocci. So I have taught you the classification. Gram-positive cocci are two. What are the two gram-positive cocci? Staphylococcus and Streptococcus. Both of them are gram-positive and both of them are circular, spherical, or both of them are cocci. So how you will differentiate Staphylococcus and Streptococcus? What is the way to differentiate them? The first question. What is the way to differentiate Staphylococcus from the Streptococcus? Can anyone tell me? What is the way to differentiate Staphylococcus from Streptococcus? It is the catalase. You have to see the catalase. The Staphylococcus and Streptococcus can be differentiated based on the ability of their catalase, right? So catalase is an enzyme. So catalase is an enzyme which is present inside Staphylococcus. So catalase positive are Staphylococcus, but Streptococcus are catalase negative. Streptococcus are catalase negative. So the first thing which differentiates Staphylococcus and Streptococcus is the catalase. So look for the catalase enzyme. If catalase enzyme, there is a test to do that. I will tell you the name of the test, the procedure, interpretation, everything I will tell you. First understand it is the catalase enzyme which differentiates Staphylococcus and Streptococcus. The thing is that if catalase is present, it is Staphylococcus, and if catalase is absent, it is Streptococcus. So catalase is the enzyme which differentiates Staphylococcus and Streptococcus. The second thing is their morphology, is their arrangement, Can you see in the first diagram, all of them are circular. The multiple small spheres are there, but they are arranged in bunches. In the second diagram also, the multiple small spheres are there, but they are arranged in chains. So you got my point, I guess. The one who are arranged in bunches, they are Staphylococcus, and the one which are arranged in chains, they are Streptococcus. Both of them are circular, both of them are spherical. That's why both of them are cocci. Both of them are gram positive. You got my point? Say yes or no. You got it? So that is the thing you can see. As I have told you, the second thing to differentiate is the catalase test. How to perform catalase test, I will tell you, but Staphylococcus are catalase positive and Streptococcus are catalase negative. So that is the thing. You got my point? So these are catalase positive. These are the first thing, they are catalase positive. Okay. So based on catalase, we have differentiated Staphylococcus from Streptococcus. Now among Staphylococcus, all Staphylococcus are catalase positive. To further differentiate them, the second enzyme we take is coagulase. Based on coagulase, we differentiate the two types of Staphylococcus. Let me come on that. Coagulase. Okay. So some Staphylococcus are coagulase positive, some of them are coagulase negative. The coagulase positive one is the Staph aureus. Staph aureus is also known as Staph pyogenes. Staph aureus. It is pathogenic, it is toxigenic. It is coagulase positive. And coagulase negative one are non-pathogenic. They do not cause disease. They are non-toxigenic. They do not secrete toxin. That's why these are non-pathogenic. And the one main bacteria here is Staphylococcus epidermidis. You got my point? So see here, the second enzyme is coagulase. Coagulase positive is Staph aureus. It is pathogenic, it is toxigenic, it forms yellow colonies. And coagulase negative are Staphylococcus epidermidis. It is non-toxigenic, non-pathogenic, and it forms white colonies. Give me a thumbs up. Everyone give me a thumbs up. So two types of Staphylococcus are there. What are the two types of Staphylococcus? Some of them are coagulase positive, some of them are coagulase negative. The one who are coagulase positive are more virulent. They are more toxigenic. They are more pathogenic. And the one who are coagulase negative, they are less virulent, they are non-toxigenic, non-pathogenic. The one who are coagulase positive, they form golden yellow colonies. The one who are coagulase negative, they form white colonies. The example of coagulase positive is Staphylococcus aureus. You got my point? And the one who is coagulase negative, the example here is Staphylococcus epidermidis. It is epidermidis. Everyone give me a thumbs up. Everyone means everyone. You got my point? Jitne audience utni thumbs up. You got my point? So that is the thing. So based on catalase, you decide whether they are catalase positive or catalase negative. If they are catalase positive, they are staphylococcus. If they are catalase negative, they are streptococcus. After that, all the staphylococcus are divided based on their coagulase activity. So if they are coagulase positive, it is pathogenic one, that is Staph aureus. And if they are coagulase negative, they are non-pathogenic one, that is Staph epidermidis. That is the classification. So after classification, let me teach you the main bacteria today, the hero today. The main bacteria in this family, Staphylococcus, is Staph aureus. So I'm going to teach you the next bacteria, Staph aureus, the most important one, that is Staph aureus. Give me a thumbs up. So let me start with Staph aureus. The first bacteria, Staph aureus. I guess everyone have written the introduction. In the introduction, you have written the name of the scientist. You have written the name of the scientist. You have written the classification. So basically, Staph aureus is a bacteria which is catalase positive as well as coagulase positive. Can I say that? Yes. The catalase positivity differentiated from Streptococcus, and the coagulase positivity differentiate it from other non-pathogenic staphylococcus. Give me a thumbs up. So the two enzymes are very necessary to differentiate Staph aureus. Staph aureus is a bacteria which is catalase positive as well as coagulase positive. इस पे बहुत MCQs you will get, not the direct one, but you will get big clinical MCQs. In the big clinical MCQs, you have to gather the clues. In the clues, it will be written that there is a patient, 42 year, having this symptom. We have taken the specimen from the pus. We have found a bacteria which is coagulase positive and catalase positive. So it should be in your mind that the bacteria which is catalase positive as well as coagulase positive, it has to be Staph aureus. Give me a thumbs up. Everyone give me a thumbs up. You got my point. So coming on the second point, that is morphology. Coming on morphology. The second point is the morphology, right? In morphology, you have to see, this is the grape-like arrangement, what I was talking about. Can you see the bacteria are circular, they are spherical, and they are arranged in bunches. They are arranged in bunches like grapes. That's why these are known as staph. The word staph means bunches. Staphylococcus. Coccus means circular, spherical. So that is the thing. So that is morphology. In morphology, you have to tell me three things. You can see here. You can differentiate the bunches from the chains. That is Staphylococcus from Streptococcus. As I have already told you, Staphylococcus occurs in bunches and Streptococcus occurs in chains. Both of them are circular, but you can see the arrangement is different. You got my point? So that is the thing. Now you have to tell me three things. What about capsule? What about spore? What about motility? Here all three things are negative. They are non-capsulated, they are non-spore forming, they are non-motile. Everyone give me a thumbs up. You got my point? So Staphylococcus are not capsulated. No, except some. Only few are capsulated, but mainly they are not capsulated. They are non-spore forming and they are non-motile. So neither capsulated nor spore forming nor motile. Always tell three things. So many students ask me, ma'am, how to learn? For 40 different bacteria to learn whether they are capsulated, yes or no, whether they are spore forming, yes or no, or whether they are motile, yes or no, it's very difficult for us. Now here all three things are negative, so it's easy to learn, but in some of them you will get various combinations. The capsule will be positive but the two things are negative. The spore will be positive but other two things are negative. The motility will be positive but other things are negative. The 2-2 combinations, spores and capsule is positive but motility is negative. Now to understand, to learn this combination is very difficult if you don't know the concept. Now what is my advice to you? Once for all, take this advice. Now life will become easy for you. Bacteriology will become super simple for you. I will give you 3 mnemonics. Now I am going to give you 3 mnemonics. One is for capsule. Out of the 40 bacteria, I will give you a list of bacteria which are capsulated. Remaining are non-capsulated. I will give you a list of bacteria which are spore forming. The remaining are non-spore forming. And I will give you a list of bacteria which are motile. The remaining one are non-motile. Learn the 3 mnemonics. Learn the 3 mnemonics. Now whenever you study any bacteria, any bacteria, Staphylococcus, Streptococcus, Neisseria, Pneumococcus, Corynebacterium, Bacillus anthrax, E. coli, Klebsiella, apply the 3 mnemonics. In the 3 mnemonics, see whether that particular bacteria is coming in capsule, yes or no, whether that particular bacteria coming in spore, yes or no, or whether that particular bacteria coming in motility, yes or no. So learn the 3 mnemonics, apply that for every bacteria. Then you don't have to learn the morphology. You have to apply the mnemonics and understand the morphology by yourself. Decide yourself whether all bacteria are capsulated, yes or no. Don't learn it. Apply the mnemonic and see. Decide yourself whether all the bacteria one by one they are spore forming, yes or no, and which bacteria are motile, which are non-motile. So let me give you 3 mnemonics now, once for all. Learn the 3 mnemonics. So I'm sorry, just a second. This is the first mnemonic in front of you. Can you see? This is the first mnemonic in front of you. So this is a mnemonic for capsulated bacteria. What is the mnemonic for capsulated bacteria? The mnemonic is in front of you. The mnemonic is Pakib MCV. Let me write Pakib. Pakiyb. Pakib. In pathology we have MCV, MCH, MCHC. So you can learn like MCV. MCV is Pak. That is Pakib MCV. It is a mnemonic. You can make some other mnemonic also if you wish. So what are the bacteria here? P stands for Pneumococcus. Okay. A stands for Anthrax. Okay. K stands for Klebsiella. You can see. I stands for Influenza. Y stands for Yersinia. B stands for Bordetella. Right. M stands for Meningococcus. So Pneumococcus bhi hai, Meningococcus bhi hai. C stands for only 2 Clostridium, not all. Only 2 Clostridium are capsulated. Clostridium perfringens and Clostridium butyricum. It is not Clostridium tetani and Clostridium difficile. They are not capsulated because they are not on this list. And V is Vibrio, but it is not the main Vibrio cholerae. Please mind it. It is Vibrio parahemolyticus. So say the full form. Pakib MCV. So 1, 2, 3, 4, 5, 6, 7, 8, 9. So out of the 40, only 9 bacteria in the world are capsulated. Remaining all are non-capsulated. So decide, is Staphylococcus is coming in this mnemonic? No, there is no Staphylococcus. That's why Staphylococcus is non-capsulated. Give me a thumbs up. Give me a thumbs up. So this is a list. You can see this is the list of spore forming bacteria. So the mnemonic for spore forming bacteria, only 4 bacteria in the world are spore forming. The mnemonic is BSc chemistry. BSc chemistry. B stands for Bacillus, both Bacillus, Anthrax and Subtilis. S stands for Sporosarcina and C stands for all Clostridia and another C stands for Coxiella. So BSc chemistry, you have to learn the name of the 4 bacteria. So Staphylococcus is not coming in this mnemonic also. So Staphylococcus is non-spore forming. The third is coming on the motility. Motile. Which bacteria are motile? Now if you want any bacteria to move, I'm sorry, just a second. If you want any bacteria to move, so you want a flagella in that bacteria. So flagella are of 2 types, Peritrichus flagella and polar flagella. You may be knowing. So I am going to give you 2 mnemonics. So the bacteria which are motile by Peritrichus flagella, so there are 6 bacteria. I will give you the mnemonic. And the bacteria which are motile by polar flagella, again there are 6 bacteria. So 6 plus 6, 12 bacteria are there. 12 bacteria are there. 6 plus 6, there are 12 bacteria which are motile total. 6 by polar flagella and 6 by Peritrichus flagella. So here is the list of Peritrichus flagella, the bacteria which are motile by Peritrichus flagella. So the mnemonic is cute baby sleep, SLEP. C stands for Clostridia, all Clostridia except perfringens and tetani. B stands for Bacillus, all Bacillus except Bacillus anthrax. SLEP. S stands for Salmonella, all Salmonella except Salmonella gallorum pullorum. L stands for Listeria, E for E. coli and P for Proteus. So learn this mnemonic, right? And polar flagella, again there are 6 bacteria. The mnemonic is very protective solution, HCl. V stands for Vibrio, P stands for Pseudomonas, S stands for Spirochetes, HCl. H for Helicobacter pylori, C for Campylobacter. Helicobacter, Campylobacter दोनों भाई और L is Legionella. So there are 12 bacteria. So Staphylococcus is not coming in these 12. Neither Peritrichus nor polar. So Staphylococcus is non-motile. You got my point? Say yes or no. So apply the 3 mnemonics. So the summary is that in the introduction you have already written that Staphylococcus is discovered by a scientist. The name of the scientist is Alexander. That is the introduction, important point in introduction. In morphology, write down 3 things: capsule, spore and motility. All 3 things are negative. These are non-capsulated because they are not coming in the mnemonic of capsulated bacteria, Pakib MCV. They are not spore forming because they are not coming in the mnemonic of spore forming bacteria, that is BSc chemistry, and they are non-motile because it is not coming in any of the mnemonic of motile bacteria, neither Peritrichus nor polar. Give me a thumbs up. So all 3 things are negative. The next heading, the next point to be understand here, is culture. The culture of the bacteria. Give me a thumbs up. Everyone give me a thumbs up if you people are there. So the third point, the next point here is the culture. So various cultures I am going to discuss here. Basically I am going to discuss six culture mediums here, right? So the first is the nutrient agar. You have to write one point. So write down nutrient agar, write down the main point in that. Write down blood agar, write down main point in that. Write one point in all of them. Have you got it? So the first point is the nutrient agar. On nutrient agar, they form golden yellow colony because they have a pigment inside them. The color of the pigment is golden yellow. That's why the color of the colony. Can you see the beautiful nutrient agar? You have to appreciate the golden yellow colonies. The pigment here on the nutrient agar is golden yellow, which is producing golden yellow colonies. This golden yellow colonies is giving a oil paint appearance. Can you see? It is looking like a oil paint. This is known as oil paint appearance. Very, very important MCQ. Which bacteria gives oil paint appearance? Which bacteria gives oil paint appearance on nutrient agar? The answer is Staph aureus. So very important MCQ. It gives glistering appearance, chamakta hua appearance dega, which is looking like a oil paint appearance. It is golden yellow colony. What is the name of the pigment which is giving this golden yellow colony? The pigment is the lipoprotein, which is bind to keratin, which is giving this golden yellow colony. That's it. That's it. So on the nutrient agar, this is please appreciate the golden yellow colonies. If you can appreciate, it is looking like a glistering smooth surface. That's why it is known as oil paint appearance. Give me a thumbs up. Oil paint appearance. The second is the blood agar. The second agar is the blood agar. You have to understand the second agar is the blood agar. On blood agar we have three type of hemolysis: alpha, beta and gamma. I will explain you the three type of hemolysis. Beta means complete hemolysis, right? So beta hemolysis is there. So on blood agar you always have to tell which type of hemolysis. Alpha means partial hemolysis, beta means complete hemolysis and gamma means no hemolysis. So Staphylococcus is showing which type of hemolysis, partial or complete or no. So Staphylococcus give complete hemolysis, that is beta hemolysis. So learn it is the beta hemolysis. How beta hemolysis is looking like? See, the colonies are there, the same colonies on the blood agar. Can you appreciate the colonies? No, zoom out. See the area around the colony. See the area. Now this is a colony. Can you see the area around the colony? The area around the colony is showing a zone, a greenish zone. That is complete hemolysis. So this is beta hemolysis. This is beta hemolysis. Around each colony, can you see beta hemolysis? So beta hemolysis is there. Around each colonies, you can find a zone of greenish color. That is beta hemolysis. The third is the MacConkey agar. The third agar is the MacConkey. On MacConkey, two types of bacteria are there. Some are lactose fermenter which produce pink colonies and some are non-lactose fermenter which produce yellow colony. I am talking about Staphylococcus. Staphylococcus is a lactose fermenter. That's why it will produce pink colony. Can you see? Just a second. It is the pink color colony. If you can appreciate on MacConkey agar, the pink color colony. This is pink one. Can you see? So this one is the pink color colonies. Can you appreciate the pink color colonies formed by Staph aureus? So due to lactose fermentation, they produce pink colonies. So we have done the nutrient agar. Nutrient agar pe oil paint appearance, golden yellow colonies. We have done the blood agar. On blood agar, it is beta hemolysis, not alpha, not gamma. The third is the MacConkey agar, pink color colonies due to lactose fermentation. The fourth one is the milk agar. The fourth one is the milk agar. On milk agar, again, they produce golden yellow colony. So you will say, ma'am, what is the difference between nutrient and milk then? On nutrient agar, the background is transparent. The nutrient agar is transparent on which golden yellow colonies are there. So they are not very easily visible, good visible. Here the background is milk. It is opaque white. Here the background is opaque and so easily recognizable colonies are there because of the opaque white background, right? So can you see the background is white in color? Now the colonies are same. It is golden yellow. Like nutrient agar only the colonies are golden yellow. If you can appreciate, all the colonies are golden yellow. But the background is different. The background is white in color, opaque white. So better contrast is there. So that is milk agar. The fifth one is phenolphthalein phosphate agar, PPA agar. PPA agar is an indicator medium. It is an indicator medium. So when colonies are formed on this medium,